And now on the line is Dr. Laura Durcan, who is one of the two vice presidents with the Irish Hospitals Consultants Association, or IHCA, and Laura works full-time in Beaumont Hospital. Laura, welcome to the programme.
Thank you so much.
Okay, Laura, as this is my first radio interview with the IHCA, could you start off by telling me a bit about your organisation, your history, and the kind of work that you do in general every year?
Of course, no problem. So the IHCA is the Irish Hospital Consultants Organisation, and we're an organisation that represent the consultants of Ireland, so the specialists who provide care in hospital for the most part, and psychiatrists in the community also. And we also advocate for patients, the patients that those consultants look after. So those are our two roles. We have close on 2,500 members. And we have lots of different roles in terms of employment and advocacy, and mostly with the dual aims of representing our members and also advocating for the patients that they look after.
Okay, the main reason I got in touch with you today is to talk about your Care Can't Wait campaign. Could you tell us a bit more about this, please?
Of course. So the Consultants of Ireland have opted to speak up where deficits in care exist. We have to speak up for our patients. We have to speak up for the 1 million people who are yet to become our patients because they're sitting on waiting lists. And this is why we started this Care Can't Wait campaign. The Consultants of Ireland have come together to say that waiting months and in some cases years for care is not okay. That spending days on trolleys while you try to access hospital care is not okay. And that patients, vulnerable, sick patients, deserve access to quality healthcare. The Consultants of Ireland are tired of apologising for substandard healthcare, and mostly it's substandard access. We know that once patients access the services in Ireland, for the most part, they're happy. But there is an extreme bottleneck in accessing outpatient services and also in our emergency departments for patients who need to access hospital beds. So in Ireland, we have about half the number of consultants that we should have, and we have a situation now where about 20% of our posts are unfilled or they're filled on a temporary basis. And this filters down directly to how we care for our patients. So in Beaumont, and I know that lots of your listeners are from Beaumont, we have, with the guidance of Ian Carter, who's our CEO, turned around many of our kind of waitlist problems. And this has been with an increase in our consultant staffing numbers. Like, for example, in my own specialty, I'm a rheumatologist, so I look after lots of people with arthritis and kind of complicated autoimmune diseases. And in rheumatology, when I started in 2016, we had a 3.5-year wait list. Now, with the addition of my post, which is a third rheumatologist, we've taken it from 3.5 years down to 6 months. And we're now in the position where we're the only place in Ireland where we're meeting the targets for patients with arthritis. We've managed, this has been, lots of hard work from our teams, but we have impacted significantly on it. But I'm sure, as you know yourself, we're now in a scenario where we're heading into the winter. We have massively overcrowded facilities in our emergency department, and there's a huge worry for patient safety at that access point into the hospital. A new emergency department in Beaumont has been approved in the national planning, but we're yet to kind of see any of that money or any true plan as to when that's going to happen. And I don't know if you've been there yourself, but the current ED, as it stands, is not fit for purpose. Dr. Pater Gilligan has raised this issue many times also. And, we need the local politicians to step up and to put that plan into concrete so that we can actually look at improving the access point to the hospital for those vulnerable patients. We shouldn't have a scenario where we keep apologising to patients and to their families for poor access to the facilities nationally. And we shouldn't, as consultants, have to keep shining a spotlight on kind of a failure to make political decisions which impact directly on care. I think that, for all of us who work in healthcare, we have an astonishingly competent and wonderful healthcare staff. But we have to convince the people who write the checks that healthcare is not a black hole, that the health of our nation is our only asset. And I suppose we should be looking at how we can spend our money smarter so that we can improve the access for our patients. we need our government to kind of make some decisions as to how we plan for our ageing population, how we plan for increasingly complex healthcare needs. You know, the patients in Ireland and the patients, thankfully, in our catchment area are living longer than ever before. And with the increasing age comes increasing costs and more kind of complex healthcare. I suppose you know, in terms of the long-term planning, I totally, Sláinte Care is an ideology that I think we're presently too far removed from at the moment. You know, if we compare ourselves to Scotland, so Scotland, very similar population, and we have 1/3 fewer beds than the Scottish, and we have half as many consultants. And I don't think anyone would consider Scotland to be the holy grail in terms of healthcare provision, but it is our nearest and closest neighbour. And they have some problems with health, you know, with quality and safety issues, whereas we have 1/3 fewer beds than them and half the number of specialists. So it's no surprise that there does come a point where, you know, there's a critical tipping in terms of outpatient waiting nationally and also in terms of the ED access nationally.
Are you saying that in Beaumont Hospital you are short an emergency department, a number and beds, but you have enough consultants in Beaumont, do you?
So if you look at the international figures for consultant staffing, we definitely continue to be understaffed. But if you look at, we have had increases in our staffing levels over the last couple of years, and that's been really the only thing that has allowed us to weigh in on our waiting list and to really pare things back so that patients have better access. So compared to other hospitals nationally, we have had some appointments, we've had some new staff, and in the areas we've had new staff, we've seen massive improvements. Where we haven't had new staff, we have a huge lack. We've had 3 dermatology resignations. Our dermatology waiting list extends to years. We're having to outsource to the private sector. The areas where we are understaffed and where we've had resignations and people leaving their posts are the areas where we have huge wait lists. And it just, to me, highlights the importance of getting senior clinical decision makers into a department, getting them seeing the patients and cracking on through the waiting list so that the patients can be seen in a timely fashion.
Occasionally, like I've done over the last 10 years interviews on several different health topics, you know, and physical and mental health. I'd be curious to know, like, how are the mental health services in Beaumont Hospital? Are they understaffed, or do you know much about that?
So there are vacancies locally in terms of consultant psychiatric posts. And as you know, there are also vacancies in terms of allied health professionals for psychiatry and mental health services. Now, I don't specifically look after any mental health issues myself, but lots of these patients present in acute crisis to the emergency department. And the fact that our overcrowded emergency department, which is extremely chaotic and has no kind of safe or quiet space for those patients, is their first point of contact, and their kind of safety point is a concern. And certainly, I think, rolls back into the point that we do need locally. That new emergency department is going to be crucial for all patients presenting, including those with mental health problems.
We'll come back to talk more about Beaumont Hospital in a minute. I'm right in saying, I believe, that like nationally there are huge regional differences. Like you were saying, in some areas in Beaumont Hospital you have enough consultants, I think, and other areas you don't. But down in different parts of the country there's a much bigger difference with the lack of consultants. Is that the case?
Yeah, so nationally we're 40% below where we need to be comparable to our neighbours. Now that's not to say to be the best in the world, but we're 40% below an average staffing level. So we're hugely understaffed nationally. There are particular hospitals that have extreme difficulties in filling their consultant posts and are heavily reliant upon expensive locums. Hospitals like, say, Letterkenny, Tralee have significant problems, but even hospitals closer to ourselves and many of the Dublin hospitals have had a lot of difficulty filling their posts. And really what this means for the patients is that there are often kind of gaps in service where they won't be seen at all, or many posts that are filled on a temporary basis at huge cost if they're locum agencies filling the post, without a thought to the kind of long-term planning of the service. Now, I suppose the reason for that is that the people appointed since 2012 are on a totally different contract term, and therefore when they're overseas, they're not wanting to come home to fill these posts where they're earning 40% less than their colleagues. You know, it makes it very difficult. Nationally, we're really good at training doctors. So we train about 40%, we train more doctors than anywhere else in Europe per head of population. But the truth is that we export huge numbers of our really highly trained graduates overseas, and that, you know, in the past, these were all people who returned home, whereas now we have a scenario where we export this medical excellence, and people don't have that same pattern where they return home to take up jobs in Ireland. On the flip side of this, we import huge numbers of doctors from Pakistan and Sudan to fill the gaps in service that we have created through the export of our own medical excellence. And it's a very difficult situation globally, because, you know, we're often taking doctors from areas of need, you know, that they're needed in their own countries, and we are bringing them to Ireland to fill gaps in service. And it's really a situation that the Medical Council, and Rita Doyle, who's the president of the Medical Council, has done a lot of work to highlight this problem. And it is something that we do need to address.
I remember a few years ago, Dr. James Riley, when he was Minister for Health, he was saying that the practice in the public health hospitals of bringing nurses from developing countries is perverse, because there's an even greater demand for them in their own countries, and they're coming to fill gaps in the Irish health system. It's mad, you know what I mean? I just have a couple more questions about Beaumont Hospital, and then we can talk at the end of the interview about what the IHCA are calling on the government to do, you know. I understand that there's a new alcohol care initiative in your hospital. Can you tell us any more about that?
Yes, so in Ireland we have the highest amount of alcohol abuse per head of population, and we have a really high number of presentations to the emergency department, either with people who are acutely intoxicated or people who have chronic alcohol misuse and the associated diseases such as chronic liver disease, and often patients presenting to the emergency department, you know, require acute detoxification, and it can be a chronic problem where they present repeatedly with alcohol-related diseases or a need for detox. We have a very well-established alcohol liaison service, and they do a great job, and we're looking to expand that service. And certainly we have a new hepatology consultant, Dr. Ryan, and he's doing a lot of work with our liver patients also. And it's really about, you know, highlighting the importance of alcohol as a factor in people's chronic diseases, and also shining a light on the number of presentations to the emergency department from people who are either intoxicated or injured in some way as a result of the alcohol. And that's not even taking account for the number of people who present with alcohol-related illnesses such as cirrhosis and chronic liver disease. So it is a huge burden on our system, and one in which we're doing our best to weigh in on.
If our country had a good relationship with alcohol, it would relieve your emergency department of huge pressure every night, wouldn't it?
Absolutely. So we do see a large volume of alcohol-related presentations, both in terms of trauma and chronic disease. And, you know, this impacts significantly on people's health, on their longevity. You know, there are many injuries that befall people under the effect of alcohol. And it's just about, you know, we do need to speak up and challenge the culture where people consider large quantities of alcohol to be kind of the norm, and where people are drinking to a point where they're blacking out or doing themselves harm. You know, that really is the definition of problematic alcohol consumption, and it is something that on a public health basis and on a population basis we should challenge, because those behaviours are harming to the individual, they're harming to society, and the kind of the result of chronic alcohol abuse for families and for the individuals is just catastrophic. So it is important that we keep this an open discussion, and that we keep discussing the effect of you know, binge drinking on chronic alcohol misuse, and how important it is that people are mindful of their alcohol intake. So we're calling on the government to make the big decisions to challenge the current narrative that healthcare is a black hole and that we're never going to get any better. We say that the health of our nation is our only asset, and that we should be spending our money smarter, and that we should be considering the money that we spend in health to be an investment in the future of our people. In order for health in Ireland to be sustainable, we do need to increase our consultant numbers, and that does mean filling our unfilled posts and considering increasing the numbers in line with our European neighbours. We also ask the government to look at our bed capacity. We have 30% fewer beds than Scotland, and although we appreciate that there is a winter plan, we really think that these beds need to be built as soon as possible. We ask that the government listen to the patient voice in this story. We need our politicians to weigh in, to fill the consultant posts, to get the patients seen, to start building the beds, because if we don't start this process, we will never improve our access to our healthcare. From a local perspective in Beaumont, I absolutely implore our local politicians to help us by improving the access point to our hospital for patients who are acutely unwell with complex health needs. The ED is their only point of access, and at present it's not fit for purpose. The plan for a new emergency department in Beaumont needs to be put in place as soon as possible, so that we can see a future and we can start to look towards that.